CVS Part 2. In the previous lecture we talked about the definition of the CVS, its components and its functions. In this lecture we'll talk about the heart, the first component of the CVS. Heart is a muscular organ made up of the cardiac muscles. The medical term cardiac is used for the heart, such as the cardiologist is one who is specialist in the heart, and the cardiomegaly term is used for the enlarged heart. In this video we'll talk about the location of the heart, structure, the pericardium, blood supply of the heart, the electrical conduction system of the heart, the cardiac cycle, and the functions of the heart. First of all, location. Heart is located in the chest cavity between the two lungs. It is just behind the sternum, which is also called as breastbone, and is above the diaphragm. The left lung has the cardiac notch. In this structure it consists of the two atrium, left and right atrium, two ventricles, left and right ventricle, and aorta along with its aortic arch, two pulmonary arteries, four pulmonary veins, two vena cavas, that's superior vena cava and inferior vena cava, and four valves, that's are mitral valve, aortic valve, pulmonary valve, and tricuspid valve. What is the pericardium? Pericardium is a fluid-filled sac that surrounds the heart. In the pericardium is the heart, roots of the great vessels, the aorta, pulmonary arteries, pulmonary veins, and the superior and the inferior vena cavas. Pericardium has mainly two layers, serous pericardium and the fibrous layer. And serous pericardium has another two layers, that's a parietal and visceral layer. The one which touches the heart structure is a visceral layer, and outer to it is a parietal layer. Blood supply of heart is that two coronary arteries that rise from the aorta, left coronary artery and the right coronary artery. Left coronary artery has two branches, left anterior descending artery and left circumflex artery. Now talk about the electrical conduction system of the heart. The electrical impulse originates in SA node and travel to the AV node. Short will pass in the bundle of His, travel to AV bundles, then Purkinje fibers and travel into ventricles. Now discuss about the cardiac cycle. Cardiac cycle has two phases. Number 1 systole, number 2 diastole. Systole is a phase of contraction in which the heart pumps the blood into the circulation. Two valves open in this phase and two closes in this phase. Aortic valve and the pulmonary valves open in the systolic phase, and diastolic phase is opposite to it, in which the heart muscles relaxes. In the diastolic phase, two valves that open are the mitral valve and the tricuspid valve. In the measurement of blood pressure, we have two readings, like normally it's 120/80. The upper figure shows the systolic blood pressure and the lower figure shows the diastolic blood pressure. Now talk about the functions of the heart. The main function of the heart is to pump the blood to all body parts. Now discuss how blood is pumped through the heart. First, the venous blood comes from the superior vena cava and inferior cava into the right side of the heart. The venous blood drains into the right atrium. There is a valve between the right atrium and the right ventricle that is called tricuspid valve. The tricuspid valves open and the blood goes into the right ventricle. Blood goes into the pulmonary trunk. There is a valve that's called pulmonary valve. Pulmonary valve and the blood goes into the lung areas by the pulmonary arteries. We know there are two pulmonary arteries that supply blood to the lung areas to get the oxygenation of the deoxygenated blood. After getting oxygenation, now the blood comes into the left side of the heart by the four pulmonary veins. The oxygenated blood drains into the left atrium. The valve between the left atrium and the left ventricle is a mitral valve. When the mitral valve opens, the oxygenated blood goes into the left ventricle. From the left ventricle, now the blood has gone into the systemic circulation. The aortic valve is there between the left ventricle and the aorta. The aortic valve opens and the blood goes into the systemic circulation. In this way, the heart completes its two cycles. First is the systolic one, second is the diastolic one. This is all about this lecture. Thank you for watching this video. Thank you so much. Take care.